Hello, my name is Jaden Gillen. Today I will be performing the skill, is it started? I'll be performing the skill of IV Start and IV Infusion. First things first, I would knock on the door, introduce myself, explain the procedure, make sure to follow all GSP guidelines, perform hand hygiene. I would identify the patient using 2 patient identifiers. I would do the 3 medication checks. I would do the 11 patient rights, and I would assess for the patient for any allergies. I've already performed my assessment, so that's done. The next thing I would do is get my IV solution and everything ready. So I make sure to get all the things that I need for my IV solution. My IV. And then I would make sure to maintain asepsis protocol. Then I'm going to spike my bag using the twist and push method. Make sure it's in there good. Fill the chamber about halfway. And then I would make sure to hang it in a high position. I would make sure to close my clamp. Hold this piece in my hand, and then the next thing I'm going to do is unclamp it. Make sure to prime my line. Okay. Once it's primed, I'll close the clamp. Place my cap back and then hang it up. That way it's not touching anything it's not supposed to be, maintaining asepsis. The next thing I would do is grab my J-loop and my sterile saline. Then I would just prime my J-loop. Okay, once it's primed, I will take it and put it back in its sterile packaging. If I can get it. Okay, that's ready. The next thing I would do is assess my patient's arms, making sure I got a good vein that I like by palpating, and that one's good. So my next step is I would perform hand hygiene. I would don clean gloves. I would take my tourniquet, making sure that it is 3 to 4 inches above my insertion site. For now, we're just going to pretend that this is a full arm, making sure to, oops. Okay, making sure that's still good. Then I would make sure to check the radial pulse. Okay, the radial pulse is good. Then I would take my my approved cleaning solution, making sure to clean the area for a good circular motion. Let that dry without fanning for at least 60 seconds. Okay, once that's dry, I will take my needle. Then, at a 10 to 15 degree angle, making sure my bevel is up, insert my needle. Okay, I see blood return. I would advance my catheter forward. Okay, then I would pinch that nerve, holding my catheter. I pull out my needle, hit my safety. Okay, and then I will attach my tegaderm. without touching my insertion site. Okay, once that's secure, pop off my tourniquet, making sure not to leave that tourniquet on more than 2 minutes. I would make sure to sign and date my Tegaderm, my skin thing. The next thing, I will make sure to take my J-loop, attach it. Okay. I will aspirate, make sure I got blood return. Oops. Okay, got blood return, and then I would flush. Okay, once that's flushed, I would take additional tape and tape down. Making sure that it's secure while assessing my patient's IV site, making sure nothing's going bad. Okay. I would make sure to label and date my Tegaderm. Then, now I will start my IV. I will make sure to scrub the hub. Okay. Grab my IV, attach it to my J-loop. Okay. Then I will open my clamp, making sure that the IV is dripping at the correct rate while also assessing my patient's IV site for any infiltration, any redness or swelling, and it looks good. Okay, once that's done, I will take my gloves off. I will report this, and then I will also make sure to assess my patient and see how well they took to the procedure. That's it. Thank you.